Welcome to the Deep Dive. We're here to cut through the noise and really get you the insights you need from the sources you share. So let's paint a picture. It's, say, 3 p.m. Tuesday. Waiting room's full, phones are off the hook, and bam, an urgent patient walks in. That schedule you carefully built, it suddenly feels like it's about to, well, completely fall apart. And look, this isn't just a one-off bad day, right? It's a constant pressure cooker for healthcare folks everywhere, juggling patient needs, administrative stuff. I mean, did you know doctors can spend up to 20 hours a week just on admin? It's staggering. That's time not spent on care. So our mission today is really to dig into how specific digital tools and maybe some services can turn that scheduling panic into, well, something you handle smoothly, confidently. We'll look at tackling those appointment conflicts and maybe even how you can outsource some of that admin load.
Exactly. We're going to look at some really practical things you can do right inside eClinicalWorks ECW, and also a pretty interesting virtual assistant service. Hopefully you'll have a few aha moments. It's not just what the tools do, but really why they make such a difference in your day-to-day, and then, for your patients too.
Okay, great. So let's start with the ECW itself. You mentioned the sort of safety net it provides for busy practices. Back to that scenario-packed schedule. Urgent patient calls needing to be seen now. How does ECW help you flex without creating total chaos?
Right. Well, it's actually quite intuitive. When you need to fit someone in, you go to the resource schedule in ECW. That's basically your master calendar view, who's available, which rooms, etc. Now, if you just double-click on a time slot that's already booked.
Okay. So you're intentionally picking a busy slot.
Precisely. You double-click it to book that second patient. And ECW doesn't block you, it pops up a conflict alert right away. Then you just click yes to say, yep, I know there's an overlap, I'm doing this on purpose, which is, crucial for those urgent visits or maybe a quick follow-up in another room. And then both appointments show up right there on the schedule, clearly marked as a conflict, often side by side, maybe different colors or icons, depends on how you've set it up.
That visual flag, the color, the icon, that seems like it would be incredibly helpful.
For the front desk trying to manage flow, right? Does it really make a difference in the moment?
Oh, absolutely. It's huge. Think about a busy morning. A quick glance tells the front desk, okay, these two patients might need different rooms, or the provider's aware they're overlapping. Without that clear visual, you might get staff trying to reroute someone or causing delays because they think it's a mistake.
Right, causing unnecessary friction. Exactly. With the alert, they can guide patients proactively. They know it's planned. And this conflict management feature, it really comes in clutch in a few situations. Obviously, those urgent patients when there just isn't an open slot anywhere. But also during really busy times, like flu season, when demand just spikes.
Makes sense.
Yeah, and also when a provider actually can handle two patients around the same time, maybe one's getting prepped in an exam room and the other is just a super quick consult, a quick check-in that can happen elsewhere. It gives you that bit of wiggle room for last-minute things without jamming up the whole day's schedule.
So it sounds like it's less about just squeezing people in and more like a strategic way to manage capacity.
Yeah.
You're intentionally using the overlap.
That's a great way to put it. It transforms a rigid schedule into something more dynamic, more responsive to actual patient needs in real time.
Okay, but what's a common worry practices have when they start allowing these overlaps? Or maybe a mistake you see people make early on?
Yeah, good question. A common misconception is definitely that allowing conflicts automatically means chaos or worse care. That's not it at all. When they're intentional and marked, it's controlled flexibility. The mistake. Often it's just not communicating clearly with the whole team.
So everyone needs to be on the same page. Front desk, nurses, providers.
Exactly. Everyone needs to know why you're doing it and what the plan is when they see that conflict flag. It's about the protocol. And look, if you do accidentally double book someone, fixing it is super straightforward, honestly. You just double click the appointment you need to move, find a new slot, reschedule. Done. It's really that simple. No big drama.
That's reassuring. The last thing you need is a complicated fix.
Right. And another helpful thing, you can use the general notes feature in ECW. Think of it like a little digital sticky note on the appointment. You can pop a quick note on there for the provider, like, hey, heads up, overlap here, just so they know what's coming.
Okay, that internal communication piece is key. Now, what about billing? Does deliberately scheduling conflicts mess up claims or reports? That seems like a potential nightmare.
That's a really common concern, but no, it doesn't mess with billing at all. Billing in ECW is tied to the services you actually provide and document, not the specific time slot.
If you are looking for outsourcing services, schedule a demo today.